Cool. Yeah, I'll stand over there. Do come in, folks. So great to see you. Sorry about the temperature. They're working on it. But if you do need to faint, please do it really quietly. So just let a few people come in, find their places. And yeah, it's so good to see you. Do come through. So, it's a big title, and we've only got 25 minutes, but I hope it is going to be useful and interesting. And we wanted to be practical and bring outcomes, which are not always things you see at a pharma conference. So we're going to do our very best to make it useful and interesting for you. There's about 10-15 minutes of content. There'll be space and time for conversation afterwards. And yeah, I'm just so thrilled you're here. Yeah, thanks for putting up with the temperature. But I'm Rob, I'm the CEO at Graphite Digital. We're an experience agency working exclusively in health and pharma. We create digital products and services for pharma, and we have about 30 people with a lot of design expertise and strategy and research as well. And I'm so thrilled to share the stage with Jamie, that we've worked with for the last couple of years. Jamie, what do you do?
Hi, Rob. Yeah, hi, everyone. Jamie McNally. I head up the Omnichannel activation team at Astellas, really charged with transforming the way we engage our HCP and patients through deployment of our Omnichannel ecosystem and some of our scalable content operations.
It's awesome to share the stage with you, Jamie. So, pharma digital. It's a pretty complicated landscape. You'll all be aware of that, particularly if you've worked in digital for some time. You know, there's the age-old debate of above brand versus brand and who's got the influence. And you know, frankly, there's no wonder that it's difficult with that. Over the last 25 years, that debate has been going on, and frankly, the brands have had the money. But how can you create a consistent experience for your audience if your finance is siloed in different places? Well, there's a bit of a problem there in itself in creating that experience. And you know, we focus a lot on HCP and patient experiences. And the reality is there's very confusing and complicated journeys. Those journeys are often regulatory informed rather than customer centric, so there's quite a challenge there. And there's also the added challenge of usability and accessibility. So many challenges in the design space to overcome. And yeah, I'd like to share a little bit about how, with one of the tools that we have, that you can begin to overcome those and create a more sustainable solution. In fact, we've done that with Astellas. And so, yeah, Jamie, from your end, what's the challenge, would you say?
I mean, I think like much of the industry, we're all striving to enhance customer engagement, right? And to do that, we need to deliver more connected omnichannel journeys and touch points. And we have an expectation that we've got to give back the organization the efficiencies of scale and protecting the bottom line. And what we saw in Astellas is the way in which brands and agencies were adopting our enterprise platforms, like for our web experiences. They were tending to really build, it resulted in a high cost of ownership, and that was coming from a very fragmented and confused online presence across brand, medical, therapy area content, which was really not allowing us to deliver any data insights or learning from these web experiences. And we're creating a lot of inefficiencies in the way we develop content, and that led to long launch times where we were seeing, you know, some websites taking up to 6 months to develop, deploy, and to approve.
Awesome. And we've been on this journey for, what, a year and a half? Mm-hmm. So Jamie, what has happened as a result of having launched the platform?
Yes, exactly. So, you know, we took up this challenge and developed a strategic investment and a very deliberate and rapid change in the ways of working when it came to how agencies and brands developed our web experiences. And we did this through the development of a global design system, really as a way to sort of lay the foundation to omnichannel success. And I believe in just 6 months since introducing the design system, we've had some game-changing outcomes. So productivity has increased. We've been able to deliver 40 websites across 15 markets in just 6 months. We've definitely had a big impact on speed to market, where we had websites taking around 2 to 3 months on average to now 2 to 4 weeks. And in terms of that cost of ownership issue, we've seen a very dramatic impact on cost of ownership, with new sites costing 90% less and 60% less to localize, like globally developed sites. So massive impact in quite a short time.
Awesome. And so part of that, there's a big technical component, but the design component is where we start and where we come in. So we've created a global design system, and you might have heard the language design system before. It's used by big organizations, Google and Helly Hansen, and most big brands have a consistent design system that they are using internationally. But it's really important and a very useful tool in pharma because of the above brand and product brand experiences. And so just to give you a little bit of a picture of what that is, it is a complete set of specifications of every design component in a website, basically, or an app, or it is the definition of what a button looks like, but not just on one website. It's on every website, and you go to the atomic detail of like what level of animation has that button got, and what is the spacing around that. It sounds very unglamorous, and it's actually quite technical. But once you do that once, and then your tech teams pick it up and replicate it or implement it really well, then you can run at pace, and that's what we're seeing that Jamie has done. And we were doing these before they were cool, if I'm honest. And we've got a very capable in-house team in this, and it's particularly useful for pharma. And so we'll get into what that's looked like. But basically, it's not only the definition and the technical design component of it, but the communication and the documentation around that, so that your tech teams really implement it perfectly. And I can't understate how important that is. Do it once right at the beginning, and then you can run at pace and create really effective digital products and services from the one source. We got to go further with Astellas, and I'm just so thrilled to be standing here with Jamie and the team, but really we've done this properly. You know how sometimes you just want to do your job properly? Well, we really got that job, that opportunity, and stage one was aligning and defining, getting to connect with the business, understanding the needs, auditing it, and then doing some benchmarking, presenting that back to the business. And then 2, into a proper iterative design approach, usability testing, so you're testing with real customers, your assumptions, which is absolutely essential for design, and refining and enhancing it, and then rolling out. And then you've already seen some of the outcomes, and we're just getting started. What about you from your perspective?
Yeah, I mean, before we get into the benefits, I think approaching HCP experience in this way is, for us, has not only created this ability to have a scalable delivery model, but it's actually removed some of the chaos in the organization that's now allowing us to have better conversations about how do we bring the organization together when we're thinking about a more holistic web strategy, and actually pulling the organization in the same direction around how do we deliver medical content, how do we deliver our brand content, and how do we build therapy area content, and dare I say, moving to the next generation of HCP portals that actually deliver some sort of tangible impact. But in a very short time, we did see very quick operational benefits, and some of this comes with the fact that you can deliver standardization but still allow flexibility. And I think that was the absolute vital part of this, that we weren't stifling agencies around a very strong templated sort of approach. So what was good is that in the toolkit we were building in standard experiences. We were always thinking about mobile first design, and all of those accessibility things that each agency was having to think of separately is now just built in as standard into the toolkit. We're able to pull in brand identity into the standard templates and frameworks. So things like brand color palettes, it's very simple to pull that all into the design system. So you're able to even though you're using the same platform, create those individual brand, therapy area, above brand type of experiences. And of course, when you've deployed these across an ecosystem, whether they're standalone brand sites or therapy area content or portals, we can make the upgrade to the design system that carries across updates across those websites. So you're not redeploying code and complicated development times just to put it in an upgrade. And obviously, from a content point of view, this is really bringing a lot of efficiency, all the way from the upstream standards and documentation that you need to onboard agencies through to the operational implementation. So there's a big shift in the way in which you focus your investment with agencies just on what they do best, which is more about the content and less about website development. And we obviously, I think you saw the impact on the launch times. I think that comes with a more efficient process, but things like MLR teams become more familiar and don't have to scrutinize so much every single website because your footers are standard, your ISI position in the US website is standard. So we're finding it becoming a lot more streamlined, not just from development, but also approval and deployment.
Awesome. And yeah, tell us about this journey, Jamie.
Yes.
Have you just told everyone they have to use it?
Exactly.
That's a leading question.
Yeah, this is where, don't underestimate the level of governance, communication, and change that you have to apply to get this right. We started with a willing participant, so we actually started with a brand that wanted to do something like this because it was in the launch space. They didn't have any legacy or baggage, so it was easier to take a new approach. So we started, small and made sure we invested in the time to actually get requirements into the setup of the design system. Clearly, it's not static, so you need a way of making the design system become like a living, breathing product. That has to come with the right ways to document things. You can't have static playbooks that sit on a PowerPoint presentation. We needed to have a place where agencies and internal brands can actually log in and see the latest, guidance and standards around our design system. And then you've got to think about how you launch it at scale, which is a combination of really thinking how you engage both your internal and external audience about your communication tactics. We did internal email campaigns. We set up agency onboarding sessions with regular Q&As. And we also gave the ability to get feedback and govern that feedback. Although you want strong governance and you're not saying yes to everything, you do need the mechanism to make sure that you're updating the design system as we go, as well as the right training and support. So all of these things have been built slowly with one brand, and then we found it quite easy to start scaling from there.
Cool. So it was a short but sweet one, but in conclusion, I just want to sort of share, and if there's one takeaway from me is design plays a critical role in your customer experience, and I think it's overlooked in this industry quite a lot. It pays to be intentional about your experience design, and as we've seen in this example, it works. Jamie?
Yes, advice here is consider where you want to start and don't go too big. Invest the time and resources to getting it starting it right. For us, web was an incubator because it was actually a crisis that we needed to solve for. So there was a clear sort of case for change that the organization understood. It was anchored in enterprise expectations that we had to deliver bottom line efficiency at scale. But what we've got now is the confidence to actually expand this idea of a global design system to all of our channels. That's something we're now embarking on, and we feel that this is the right foundation where if you get this right upstream, you can pull it through downstream to things like modular content. So it takes away the chaos of how you actually apply modular content because you've got a framework by which those modules are designed in a standard way. They're organized in a way that they can pull into standard frameworks, and we can start to think about how AI plays a role once you've got that baseline foundation.
What's next?
Yes, I sort of mentioned it, but yes, we're now we're really internalizing the global design system as an Astellas product. It's going to become something that we are putting in the governance and starting to build the standards across our touch points, our channels, whether it's web, e-detail aids and CRM or marketing emails and so on. So yeah, this is our foundation now for us really transforming the way we develop content and the way we deploy that content into our channels.
Cool. Thanks, Jamie. So, any questions, folks? Hey, look at that. And these guys aren't even the plants. Come on, Alex. Go on.
Yeah. Actually, I have a question for each one of you.
Oh.
First of all, for Europe, I've seen projects like this, and I'm from the software development part of it. So I fully engage with this. It brings a lot of benefit to these companies, and it's easier for the developers as well to develop something because you just do it once, and after that you just adjust it. You don't need to reinvent the hot wheel, the hot water, sorry.
Yeah.
In there. What I've seen in there is where is the struggle at the beginning is getting the other agencies on board with this and maintaining the system in there. Yeah. How did you do that in Astellas? How did you get the other agencies of record to stick to the design and to actually
Yeah.
the bills?
Yeah, exactly. There's a little bit of stick and carrot balance here. At Astellas, I'm sure like everyone else, the budget is changing, where that budget is allocated and how. And we know that, markets like the US may have bigger budgets and it takes a bit more time to transition to something like a standard design system. You probably have to spend longer listening to the various design needs of the different agencies, and that's something we're doing before making the shift. But for everyone else, marketing budgets were coming out of markets. They would struggle to keep, the ways of working with agencies that they've always had. So I think that was the stick approach. And then for the agencies, it was really showing the flexibility of the system and getting them to input into how that should function. We had silly, long conversations about things like, should a call to action be rounded buttons or square? But you have to spend time sometimes on those topics to make progress. But yeah.
Yeah. And if you
second part of the question, sorry, it was actually for internal stakeholders because we also seen it's a change in there. And for example, a real example that we had in a project of ours, there was an agency that implemented the design system, and there was also an asthma brand that they wanted. It was 1 year since they launched the brand, so they wanted a dragon in there, which was not in the design system. So how do you cope with that? Like, how do you make them to understand? Yeah, we can have a dragon, but what's the point of that? Like, does it really make the benefit of this? So how do you manage those?
Yeah, we've got like a backlog approach. So clearly there's a roadmap on the design system where we are aiming to take on the feedback and prioritize that feedback based on tangible impact. So is a dragon really going to change the way in which a HCP engages with a site?
Yeah.
We can debate that, but there are probably things that are more obvious that we need to put in place. So it really is the governance and how you take the feedback, have a transparent way of assessing that and putting it in the right place in the priority list.
And it's also support. From our perspective, it's support as well. So we work with the agencies that are using the design system and help them make the most of it, right? Because if they're not engaged with it or don't know how, then they won't. And so that's why the content, the experience, and the onboarding is really important to get right. And the financial results speak for themselves. If you have every agency designing a button, that's just crazy spend of money. So you might as well do it once and do it right.
Yeah. And I would say as well, it actually helps. Well, it gives some good feedback to procurement on if you're trying to consolidate agencies, which ones are the ones that are worth working with, because we use a fairly standard toolkit called Figma, and it's quite incredible how many agencies don't actually know how to use that. So it's helping us to assess who are the agencies that get where we're going in the future as well.
Go for it.
I had a question for you about the MLR side of this. So I recognize the value of internal MLR teams saying, okay, this makes sense. How was the external, like the labs in Canada, the FDAs in the US, the EMEA evaluators, how did they view sort of like this consistent pattern? Like, is there any reduction in the amount of time that they're spending?
I don't think, I couldn't comment on the sort of external authorities and how they view these standards, but obviously we're baking in country regulatory expectations. So like US, we know it has to have the safety information visible on 60% of the page, whatever it is. at least we've done that in one way, because the way it was being done is every website, it was on that side or it was there. So it's become, I guess there's less scrutiny required because it's recognized that Astellas is doing the same thing every time, not reinventing some of these sort of regulatory standards that are sort of built in.
So your front-end standardization then is not just language, but it's also geographic jurisdiction.
Yes,
too, right?
yes.
And once that's done, it's done. Cool.
Yes, exactly.
Okay,
Yeah.
cool,
Exactly.
thanks.
Yeah.
Cool. Just while I'll come to you straight away, but Amy at the back will kill me unless I show you this. So every year we do a research report. So we have research and design in-house, and we go and ask the market, ask 100. This year we've asked 100 pharma digital experts what they are thinking about and working on and what their challenges are. We're really proud of this report. You might have seen some of the headlines in the last few years. This is the third year. Thank you. You know what to do. So actually it launches next week, but you guys, very lucky to get it today. Yes.
Thank you, very interesting presentation. Obviously you talked a lot about the operational benefits, from which I can see are very tangible, but I'm interested to know whether there's been tangible benefits in terms of the customer experience. So has there been more traffic? I don't want to put words in your mouth as to how you measured it, but has there been sort of those tangible benefits?
Yes. So we are, yes. And like Rob said, you know, some of the things that we built into the design system come from, you know, previous research. So we're obviously building, you know, a much better way of navigating the mobile-first, responsive approach, accessibility standards, things like that. I think we're in early days to say, you know, the transition from legacy to now has had a dramatic shift in engagement. What it's helping us to do is design the next generation of HCP portals where historically our organisation has been quite fragmented, and we've, you know, created individual experiences for every type of content instead of something that might be more of a platform and service approach.
And on that point, what you're able to do when you standardize this is, it's not just the UI, by the way, it's the user experience as well. So one of the biggest things or best things you can do in terms of increasing your engagement is optimizing the onboarding flow into a website. And we've done research around this and sort of implemented that best practice into the design of the system, so that whenever an agency wants to build or something, you know, they are inheriting from that journey plan as well. And so, yeah, it cannot help but improve the effectiveness if you have a standard sort of approach to. It doesn't mean you've solved it for everything, but you know, it's certainly an improvement. And then, of course, you've got the Lego bricks, and it's just how you bring those together with your content that allows you to develop things faster and better.
Yep.
I think we're out of time. We're certainly pretty warm in here, folks. But I just want to say thank you so much for coming. We're around, and certainly at the bar later on if you'd like to talk about it. Cheers.